Good day everyone, I am Madiga Said and now I am going to show you the procedure on urinary catheterization. The introduction of a urinary catheter through the urethra into the bladder to installation or removal of fluids. Here are the purpose. First, relieve urinary retention, obtain a sterile urine specimen, measure the residual urine remaining into the bladder after voiding, control urinary incontinence, provide access for instilling medication into the bladder, maintain an empty bladder during surgery, and monitor hourly urine production in seriously ill client. Let's first perform the urinary catheterization on a female client. So first, review the client's health record, check client's chart for physician order. Catheterization is only if with medical order. Name, Shaira Talib. Date of birth, June 2, 1980. Doctor's order, insertion of urinary catheterization if client unable to urinate within 10 hours. The client has no known allergies. Identify the client and establish rapport to ensure the right client and elicit cooperation. Today, ma'am, I am Madiga Said, your student nurse for today. What is your name and your date of birth? And now, I'm going to perform on urinary catheterization to drain the urine on your bladder. Assess the need of a client for catheterization. Explain the procedure to the client to elicit cooperation of client. Provide a good light. Good lighting is necessary to locate the meatus clearly. When did you last time urinated?
I think it's been 10 hours.
So next is gather the needed equipment. Organization promotes efficient time management. So this is the catheter kit, and now I'm going to open it away from you first, like this, and from side. Another side, and the near from you. This is considered as a sterile field. Provide privacy by closing door and pulling the curtain. The client has the right to be protected from being exposure to others. Replace top sheet with bath blanket. Place waterproof underpad under the client's buttocks. This protects the bed linen from the moisture and getting soiled. Can you lift your buttocks so that I'm going to slide this underpad? Place in a dorsal recumbent position with the feet apart and drape the client. Good visualization of the meatus is important. Embarrassment, chilliness, and tension interferes with the introduction of the catheter. I'm going to position you in the recumbent position, and can you flex your knees? Do perineal care or flushing procedure. Remove and discard using working gloves. Cleansing the perineal area prevents introduction of bacteria. Open the catheterization pack and bring it near the perineal area. Placement of the equipment near the work site increased efficiency. Amount of lubricant over sterile field. Organization promotes efficient time management. Get 2 cotton balls from the pack and place on the sterile field. Pour betadine over there. Put on sterile gloves to avoid cross-contamination on microorganisms. Grasp the upper corners of the eyes are frustrated drape and unfold it without touching the sterile areas. A drape provides a sterile field where the equipment and hands will be placed, prevents accidental contamination from adjacent areas. 2 inches of the catheter tip, avoid clogging the tip of the lumen.
Yung malubricate. Yan, go.
Lubrication facilitates the insertion of the catheter and reduces trauma to the tissues. With a thumb and forefinger of your non-dominant hand, spread the labia and identify the urinary meatus. Maintain and hold until the catheter has been inserted. Starting away from you. And near from you. Discard. Use the area and minimize the risk of urinary tract infection by removing surface of pathogen. Insert the tip of the catheter into the dimple of the leg structure below the clitoris, which is the meatus, about 2-3 inches or until urine flows. Do not force the catheter through the urethra. Ask the client to breathe deeply and rotate the catheter gently if slight resistance is met. The sphincter relaxes and the catheter can enter the bladder easily when the client relaxes. Ma'am, I'm going to insert the catheter, so take a deep breath. Hold the catheter securely with your non-dominant hand while the bladder empties. Collect the specimen if required. Continue this drainage according to hospital policy. Remove the catheter smoothly and slowly if straight catheter is used. The catheter is only needed to drain urine present in the bladder and is not intended for continuous use. If a poly catheter is used, introduce 5 cc or follow manufacturer's instruction of distilled water to secure the catheter. Gently pull the catheter until retention balloon is smuggled against the bladder neck. Resistance will be met. Remove the fenestrated drape. Creates a balloon to ensure catheter retention. Maximize continuous bladder drainage. Proper attachment prevents trauma to the urethra and meatus from tension on the tubing. Attach catheter to the urine bag below the level of the bladder. Tape catheter to the tile. To avoid the flux of urine to prevent infection or UTI. Place client in a comfortable position. Do aftercare of the equipment used. Remove gloves and do hand washing. I'm done now, and I'm going to place you in a comfortable position. And do hand washing. Hand washing prevents the spread of the microorganism. Discard. Label the urine specimen and send to the laboratory promptly. Urine kept at room temperature may cause organism if present to grow and distort laboratory findings. The following: date and time procedure started and ended. Client's response, reaction to the procedure. Record client's output if required. A careful record is important for documentation after the client's care. The reporting and recording of information about the procedure must be accurate and timely for continuity of care. So next, the step-by-step of process and the procedure of the urinary catheterization for the male client. Procedure, just follow the step 1 to 13 procedure in the female catheterization like I did before, like provide privacy, check the client's chart, explaining the procedure in the clients. Grasp the upper corners of the fenestrated or eye drape and unfold it. Place the fenestrated drape aseptically over the perineal area with the penis extending through the opening. A drape provides a sterile field where the equipment and hands will be placed. Prevents and accidentally contamination from adjacent areas. Holding the penis with a non-dominant hand, disinfect the meatus twice using cotton balls with betadine and antiseptic solution. Starting from the top, use circular motion, stroke, then downward for each cotton balls and discard. Cleanse the area and minimize the risk of urinary tract infection by removing surface pathogens. Lubricate 6 to 8 inches of the catheter teeth. Avoid plugging the lumen. Lubrication facilitates the insertion of the catheter and reduces trauma to the tissues. Hold penis perpendicular to the body and pull up gently. Hold the catheter in the dominant hand. Steadily insert the catheter about 8 inches until the urine is floated in the drainage bag or tubing. Advancing an indwelling catheter, an additional half inch to 1 inch ensures placement within the bladder and facilitates inflation of within the bladder and facilitates inflation of the balloon if Foley catheter without damaging the urethra. Do not force the catheter through the urethra. The sphincter relaxes and the catheter can enter the bladder easily when the client relaxes. Ask the client to breathe deeply and rotate the catheter gently if slight resistance is met. Sir, I am going to insert a catheter, so please
Deep breath.
take a deep breath. The catheter securely with your non-dominant hand while the bladder empties. Collect a specimen about 20 to 30. Urine as needed. Move the catheter smoothly and slowly. Straight catheter is used. The catheter is only needed to drain urine present in the bladder and is not intended continuous use. If a Foley catheter is used, introduce 5 cc or follow manufacturer, secure the catheter, gently pull the catheter until the retention balloon is snuggled against the bladder neck. Creates a balloon to ensure catheter retention, maximize continuous bladder drainage. Proper attachment prevents trauma to the urethra and meatus from tension in the tubing. Attach catheter to urine bag below the level of the bladder. To avoid reflux of urine to prevent infection, tape catheter to the lower abdominal area.
Yan.
Remove and clean the equipment. Make client comfortable. Label the urine specimen and send to the laboratory promptly. Urine kept at room temperature may cause organisms if present to grow and distort laboratory findings. Wash your hands. Hand washing prevents the spread of microorganisms. Record the time of the catheterization, the amount of the urine removed, a description of the urine, the client's reaction to the procedure, and other observations. A careful record is important for documenting data after the client's care. Next procedure is the removing the indwelling catheter. First, check the orders on the client's chart. Removing of urinary catheter only done if with medical order. Obtain a 5 to 10 ml syringe depending on the size of the balloon of the catheter and an absorbent towel. Next is wash hand. Hand washing prevents the spread of the microorganisms. With the ticket, call out client's name, check the client's identification band, and explain the procedure. Inform the client that there may be a slight discomfort as the catheter is removed. To ensure the right client and elicits cooperation. How are you? Are you Shaira? And now, I'm going to remove the indwelling catheter. It is a bit painful, but you can tolerate it. Then gloves. To avoid cross-contamination of microorganisms. Place the absorbent towel on the mattress under the catheter and attach the syringe to the balloon port. Withdraw all the water or solution from the balloon. This protects the bed from linen, from moisture, and getting soiled. I'm going to expose this. Ma'am, can you flex your knees? Okay. Hold the absorbent towel in your non-dominant hand in front of the perineum. Pinch the catheter near the meatus with your dominant hand and pull it steadily out onto the absorbent towel until it ends retrieved. Hold the catheter at an upward angle to the drainage tubing so that may urine it will be drained into the drainage bag. Inspect the catheter to make certain it is intact. If it is not, notify the physician immediately. Measure the output in the drainage bag. Record the output on the I&U sheet. Empty the urine into the toilet bowl and dispose the urine bag into the yellow bin. And now I'm going to turn you in a comfortable position, ma'am. Remove gloves, wash hands, and make the clients comfortable. Instruct the client to drink extra fluid and warn that there may be mild burning with the first few voiding. Remind the client of the expected voiding time. Discard. You should drink a lot of fluids, and later on, you will expect that you are urinating with a burning sensation. And now, you need to document the following: the removal and the time by which the client should the next voiding time. A careful record is important for documenting data after the client's care. The reporting and recording of the information about the procedure must be accurate and timely for the continuity of care. Hello, I hope you enjoyed the vlog I did.